Welcome to the deep dive. Today, we're taking a closer look at something pretty common in the horse world, but maybe not always fully understood: equine oral plaques.
That's right.
We've dug into some really interesting sources to figure out, what they actually are, where they come from, and importantly, what we can do about them.
Mm-hmm.
The idea is for you listening to come away feeling like you really get the picture on this specific equine health thing.
Absolutely. And it's important because, well, they might just look like a cosmetic issue, maybe, but these plaques can genuinely affect a horse's comfort, their behavior even.
Right.
So understanding them is key.
Mm.
And the cause is actually quite surprising.
Okay, let's start there then. What exactly are these things? People call them cauliflower florets,
Yeah.
right? What do they look like?
Yeah, that's a pretty good description, actually. They're these whitish, sort of depigmented, meaning they lose color, clearly defined bumps, papules, and plaque.
Okay.
You find them on the inner surface of the horse's ear. That nickname, cauliflower florets, it really sticks because it helps you picture those raised, slightly lumpy-looking areas.
And they're benign, not cancerous.
Correct. They're benign skin lesions, technically sometimes called papillary acanthoма or ear papillomas.
Papillomas, like warts.
Sort of in the same family, yes.
Hmm.
They can show up as just one spot or several, or sometimes they kind of merge together into bigger patches.
Mm-hmm.
And they usually feel firm if you touch them. It might have, like, crusty or flaky bits on the surface.
And always inside the ear flap.
Almost exclusively, yes. On that hairless inner part of the pinna that's the ear flap, you really don't tend to see them on the outside, hairy part of the ear.
Got it. Okay, so we know what they look like, but the big question, what causes them? You mentioned a surprising culprit. It's not just like dirt or irritation.
No, it's more specific than that.
Hmm.
The main cause is actually an infection. It's an equine papillomavirus, ECPV for short.
Of like,
Yes, and specific types, ECPD 3, 4, 5, and/or 6, are the ones consistently found in these plaques.
so how does the horse get this virus in its ear?
Now that's the really interesting part. It involves insects, biting insects.
Flies.
Exactly, specifically black flies, the ones from the genus Similium. They act as what we call mechanical vectors.
Mechanical vectors,
Yeah.
meaning they just carry it.
Precisely. They aren't infected themselves in a biological sense, but they physically move the virus.
Hmm.
Think about it. The inside of a horse's ear is sensitive skin, relatively protected.
A good spot for flies to feed, I guess.
Right. So the black flies bite the inside of the ear, which causes irritation and, crucially, tiny little breaks in the skin, microscopic damage.
Okay.
And that provides the entry point for the papillomavirus, which might be present on the horse's skin or transmitted from another horse via the fly's mouthparts.
Wow. So the fly bite opens the door.
Exactly. Once the virus gets into those skin cells, it basically tells them to multiply abnormally. This leads to thickening of the skin layers. Hyperkeratosis and acanthosis are the technical terms.
And that makes the plaque.
That creates the raised plaque, yes.
Right.
And over time, it also causes that loss of pigment, the white appearance.
So it spreads via flies, but are the plaques themselves contagious? Like if one horse touches another's ear?
That's a really important distinction.
Yeah.
No, the plaques themselves aren't considered directly contagious through just casual contact, like horses grooming each other or standing together. The transmission relies on that intermediate step, the biting fly.
That makes sense. It's amazing, though, how a tiny fly can kickstart all this. So, which horses tend to get these? Is it specific breeds or ages?
Not really specific breeds or sexes, no. They're found pretty commonly across the board. But you rarely see them in foals or horses under a year old.
Interesting. Why is that?
It likely relates to cumulative exposure. The longer the horse is around, the more seasons of fly exposure they've experienced.
Ah, okay. So maybe more common in older horses.
Potentially, yes. The data shows pretty high incidence rates, too. Like one study in Brazil found nearly 15% of horses affected, while in the U.S., estimates are often higher, maybe 20, 24%. And on some farms, it's really prevalent that Brazilian study found 85% of farms had at least one affected horse.
So, very common. What signs should an owner actually look for? I mean, besides seeing the white patches.
Well, that's the thing. A lot of horses with these plaques, they show zero signs of discomfort. They're completely asymptomatic.
Really? So they don't even notice them?
Seems that way for many. But for others, it's a different story. The main sign is sensitivity around the ears.
Like they don't want you touching their ears.
Exactly. They might start resenting bridling or get fussy when you try to groom their head or ears. They become ear shy or head shy.
Okay.
And often, that sensitivity is what prompts the owner to call the vet, rather than the look of the plaques themselves.
So the behavior change is the clue.
Often, yes. You might also see that the irritation seems worse when flies are bad, which makes sense. And some horses might even start shaking their heads more than usual.
Right. So if you, the owner, suspect your horse has these plaques, how does the vet confirm it? Is it complicated?
Usually, no, it's pretty straightforward. The diagnosis is typically based on just looking at them, that classic visual appearance we talked about.
The white, crusty patches inside the ear?
Exactly. The vet will do a good visual inspection, maybe gently feel the plaques, to check the texture and see how sensitive the horse is to touch there.
But could it be something else? Are there lookalikes?
Good question. Yes, there are definitely other things a vet would consider, especially if the lesions don't look perfectly typical.
Like what?
Well, sarcoids, those common skin tumors, can sometimes appear near the ear, though often more on the edges or outside. Melanomas, especially in gray horses, could be a possibility.
Okay.
Fungal infections like ringworm can cause crusty skin changes. There's also an autoimmune condition called pemphigus foliaceus, though less common. And sometimes just a really severe reaction to fly bites themselves might look a bit similar initially.
So how do they tell the difference? Biopsy.
A biopsy can provide a definitive diagnosis, confirming the papillomavirus changes in the skin cells. But honestly, it's rarely needed for typical oral plaques because they look so characteristic.
Okay.
A vet would likely only suggest a biopsy if something looked really unusual or if there was any concern about something more serious, like malignancy, which is extremely rare for these.
And things like blood tests or x-rays?
No, standard lab work like blood counts, chemistry panels, or imaging are not used for diagnosing oral plaques. It's really about the clinical exam and appearance.
Right. So let's get to the big one, treatment. If your horse has these, what do you do? And this is where it gets interesting because you said earlier, sometimes the answer is nothing.
Exactly, and this is so important for owners to hear. For many horses, if they are completely asymptomatic, not bothered by the plaques at all, the best approach is often benign neglect.
Benign neglect, just leave them alone.
Pretty much. Because, and this is key, trying to treat plaques that aren't causing a problem can sometimes backfire. Aggressive treatments can actually make the ear more sensitive.
Ah, so you could create a problem where there wasn't one.
Precisely. So if the horse isn't showing any signs of discomfort, no head shyness, lets them bridle, fine. Leaving the plaques alone is often the recommended course.
But what if the horse is bothered? If they are ear shy or head shy because of them?
Then, absolutely, treatment is warranted. If the plaques are causing sensitivity and affecting the horse's behavior or comfort, we need to intervene.
Okay, so if treatment is the way to go, what are the options? What actually works?
Well, first let's talk prevention and management, because that's crucial regardless. Fly control is paramount.
Makes sense given the flies are spreading the virus.
Right. So using fly masks, especially those with good ear coverings, is really helpful. Applying effective insect repellents inside the ears carefully, of course, can make a difference. Look for products active against black flies.
Like permethrins.
Permethrins or pyrethrins can help, yes. And also, stabling horses during those peak black fly times, usually dawn and dusk, can reduce exposure.
Okay, that's management. What about actually treating the existing plaques if they're causing trouble?
For symptomatic cases, the go-to treatment, the drug of choice nowadays, is a topical cream called imiquimod. It's usually a 5% cream.
Imiquimod, how does that work?
It's what's called an immune response modifier. It basically stimulates the horse's own local immune system in the skin to fight off the papillomavirus. It has antiviral properties, too.
And does it work well?
The success rates reported are actually quite high. Studies show around 87–88% resolution of the plaques themselves and about 71% clearance of the actual virus DNA from the site. So yes, it can be very effective.
That sounds great. Is there a catch?
There is a significant consideration, yes. Imiquimod works by causing inflammation, a lot of inflammation.
Uh-oh. What does that mean for the horse?
It means during treatment, the ears are likely going to look much, much worse before they get better. You'll see redness, significant swelling, crusting, sometimes oozing, and importantly, pain.
Pain. So the horse will be more sensitive during treatment.
Very likely, yes, especially initially.
Yeah.
This is a really critical point for owners to understand and be prepared for. It's part of how the drug works, driving that immune response, but it's definitely not pleasant for the horse in the short term.
Wow, okay. That's crucial info. How often do you have to apply it? And for how long?
The protocols vary a bit. A common approach is applying it, say, 2 or 3 times a week. Sometimes vets recommend doing that for a week, then taking a week off, cycling like that for maybe 3 or 4 months.
Okay.
There are also protocols using it more frequently, like every 48 hours, which might lead to faster resolution, but potentially more intense inflammation.
And applying cream inside a now very sore ear. That
Yeah.
sounds difficult.
It absolutely can be. Sedation is often necessary, especially for the first few treatments, just to be able to clean the ear properly and apply the cream safely and effectively.
Are there other potential problems with the treatment?
Yes, you need to be careful. If you apply the cream too thickly, or if crusts aren't gently removed before reapplying, you could sometimes get erosions or even ulcers in the ear canal. So careful cleaning and proper application technique are really important.
So monitoring is key.
Definitely. And sometimes vets will prescribe other things alongside it, maybe topical corticosteroids between imicimod applications to manage some inflammation, or NSAIDs like phenylbutazone for pain relief, or antibiotics if a secondary bacterial infection sets in.
And what about just basic handling, like clipping ears?
Good point. For horses with plaques, especially if they're sensitive but not undergoing the imicimod treatment, you definitely want to minimize ear handling and avoid things like ear clipping, because that can just aggravate the situation.
Okay, so putting it all together, what's the long-term outlook for a horse with oral plaques? Are they stuck with them forever?
Well, the good news first.
Yeah.
These plaques are benign. They aren't cancer. They don't spread to other parts of the body. So the prognosis for the horse's general health and lifespan is excellent.
That's reassuring.
Yes. However, if we're talking about getting rid of them completely and permanently, the prognosis is a bit more guarded.
Why is that?
Because even if the plaques resolve, the papillomavirus itself can remain latent, kind of hiding out in the cells. So recurrence is possible down the road, though studies suggest it's not super common within the first couple of years after successful imicimod treatment, especially if you maintain good fly control.
Okay, so for horses that weren't bothered in the first place.
For asymptomatic horses, the prognosis for a perfectly normal quality of life is excellent. They just live with the plaques.
And for the ones that were bothered and got treated.
For those symptomatic horses, the prognosis for resolving the behavioral issues, the ear shyness, the head shaking, is generally good once the plaques are successfully treated with something like imicimod, despite the difficult treatment phase.
Does the skin go back to normal afterwards?
Sometimes there can be some residual skin changes, maybe some permanent depigmentation white patches where the plaques were. But the key thing is that the sensitivity and the associated behavioral problems usually improve significantly once the active plaques are gone.
That makes sense. It's a lot to take in, but really helpful. All right, that pretty much wraps up our deep dive into equine oral plaques. It's definitely clear that while they can seem like just a nuisance or be genuinely frustrating for owners dealing with a sensitive horse, understanding that it's a virus, that flies play this huge role, and knowing about treatments like imicimod, including the challenges, gives a much clearer path for managing it.
Absolutely. And maybe a final thought for you to consider.
Yeah.
It really highlights how something seemingly small, like a tiny biting fly, can trigger quite a complex biological process inside the horse, leading to real discomfort. And it's our understanding of these, intricate interactions that lets us develop these targeted, even if sometimes difficult, treatments. Makes you wonder, doesn't it? What other simple-seeming interactions out there might be having profound effects on animal health that we just haven't fully unpacked yet?